Good evening and welcome to this episode of Beef Tips and Gravy. I'm John Houston, Director of Business Services with ProTrition Feed. It's my pleasure this evening to have Dr. Kevin Cox with us. I have a long association with Dr. Cox. Dr. Cox is a veterinarian that has worked his whole career working with beef cattle, horses, other livestock. And so we want to talk to Dr. Cox. Welcome. And we want to talk to you specifically about our brood cows. And so I guess the first question I would have, Dr. Cox, as we get into this is, what diseases would you be most concerned about in the normal brood cow operation?
In brood cows, we're specifically worried about respiratory viruses that might cause abortions. So things like BVD, IBR, PI3, and BRSV. The most serious of those, of course, are BVD and IBR. We also are concerned about lepto, and leptospirosis can cause late-term abortion. So we are most concerned about vaccinating for those diseases. Blackleg, of course, is a major disease that kills a lot of young calves. And so while we don't really worry about adult cows getting blackleg, we do encourage people to vaccinate for blackleg so that we can get good colostral immunity passed on through the milk and protecting the calves that way. If you are leaving a bull in year-round, which we encourage people not to do, but if they are, then we're also worried about Vibrio.
Okay, so if you think about all of those diseases you just mentioned, some are viruses, some are bacterial complexes, and some of those things, are we given that many shots, or can we get all that in one bottle, or how does that work? Yeah,
that's an excellent question. So when you think about the number of diseases that we're talking about, we're probably talking about 4 or 5 viruses and possibly 5 to 6 strains of lepto. And so, you wouldn't want to give the cow that many separate injections. And so it's convenient that the manufacturers have made vaccines for us that all of those antigens are included in one vaccine. So you can stick one needle in the cow and get vaccination for all of that. Now it depends on which vaccine that you're using as to how that comes and how they're packaged, but you can buy vaccines that have all of those in them. Blackleg would be separate. That would be one vaccine that's not included in a combination type vaccine. You would have to use a separate needle for that.
So as we think about that, one of the big topics, and I think if you go to a co-op store and you look in the cooler and you have all these vaccines, some are in boxes, some are in bottles. As you think about that, tell us a little bit about the difference between a modified live virus vaccine and a killed virus vaccine, and which would be most appropriate, if any, in the brood cows.
Yeah, so the cooler is an intimidating place. It can definitely be intimidating when you walk into a co-op store and you look in and you're trying to make a decision about which vaccine is best for your cattle herd. What we call ready-to-use vaccines are killed vaccines, and they're actually already in the bottle. They're already mixed for you, and you don't have to do anything other than making sure that they're kept at the appropriate temperature. They're slightly more expensive because of the convenience factor. They are already ready to use. But they're also extremely safe, and there's very little risk of causing any harm to the cattle herd. So those would be killed vaccines. If you look at vaccines that are in boxes, those are modified live vaccines, and they have to be mixed. There's a powder portion mixed with a liquid portion, and they are effective. They're extremely effective. Actually, some people would argue that they're slightly more effective than killed vaccines, but they do have a little bit of effort required on the part of the producer. They produce great immunity, but they do need to be used in an appropriate manner. So you would not want to use a modified live vaccine in a pregnant cow if she had never been vaccinated with a modified live vaccine at least once while she was open. So there's a little bit of risk involved in using modified live vaccines if you use them inappropriately.
So mainly they have to be managed a little more.
Yes.
From a modified live standpoint. Talk to us a little bit about boosters. You know, a lot of the labels will say booster in, 3 weeks, 4 weeks, whatever the label says, but is that booster really necessary? Some people, say, hey, I got them in the chute, that's all I'm going to do. Tell us what your opinion is about the booster.
Yeah, I guess the opinion about boosters may not be a popular opinion, but if it says on the label that it needs to be boosted, it really does need to be boosted. The killed vaccines especially need that original dose and then a booster dose to get the amnestic response. And that's a fancy way of saying that the body kicks in and starts remembering what that antigen looks like and makes extra antibodies because it recognized that and said, hey, we've seen this before, it's a virus that we don't need to get, so we're gonna make extra antibodies. So if the label says that it needs to be boosted, it generally does need to be boosted in 3 to 4 weeks, depending on what the label says. And I realize that may not be convenient, requires extra effort, but when you think about the fact that you're spending money on these vaccines and you want them to work, if you don't use them appropriately, they're not going to work, and then all effort is at waste.
Right. So just 2 or 3 more questions before we finish, but tell me a little bit about the hot topic of persistently infected calves and how we might prevent that when vaccinating our cows.
Okay. So persistently infected calf refers to a disease called BVD. And most of the time when a cow is infected with BVD during her gestation, it will cause an abortion. But there is a window of time when the cow can get infected with that disease, and if she doesn't abort, her calf that's in utero or a fetus can become infected with that virus and be known as a persistently infected calf. And that causes that calf to be able to spread that virus and shed that virus for the rest of its life, though that calf may not be sick at all. So it's kind of like, a gift that keeps on giving. It's a calf that's not sick, but it exposes all other animals to that particular virus. And so there are vaccines in the industry that are known to prevent against persistently infected BVD calves, and they're labeled that way. Most of them are modified live vaccines. So there's a little extra management involved in that, but the vaccines are labeled, and if used appropriately, do a really good job of preventing persistently infected BVD calves.
Okay, so if we think about brood cows, and as we kind of wind up this episode, there's some other things that really are problems with our brood cows as it relates to pink eye, or it relates to maybe foot rot. And I know there are some pink eye vaccines out there. First, talk a little bit about those, and then what the treatment would be and what might be labeled and what really isn't labeled.
Sure. Yes, so there are pink eye vaccines available on the market, and there's one pink eye vaccine that's in combination with a blackleg type product, so you can give it that way. I think we have to be careful about our expectation of pink eye vaccines. We have really good vaccines that are on the market, but we can't expect that we're going to get 0 cases of pink eye when we use a pink eye vaccine. What we hope is to reduce the number of diseases that we have, but we also want to reduce the severity of that outbreak when we have pink eye. So I encourage people to use pink eye vaccines, but I also encourage them to temper their expectations of what they're going to see from that vaccine. In terms of treating pink eye, we recommend the oxytetracycline antibiotics that are injectable. That's probably the best over-the-counter treatment. Occasionally we'll get a strain of pink eye that doesn't respond to the oxytetracyclines, and then sometimes we have to step up to an RX product and that your local veterinarian could help you with.
Okay, real good. So as we think about the brood cows and we think about all the things that can happen, and from a disease management standpoint, what we're really talking about is just management and timing of those vaccinations. And so as we wind up, how close to calving would be best to administer our vaccines, or is it even important?
Well, that's a really good question, and if you ask lots of different veterinarians, you probably get a lot of different answers. But From my perspective, I believe that vaccinating early in gestation is probably the best because the lepto portion of those vaccines needs to be in the cow early on in order to prevent late-term abortion or stillbirth related to lepto. Now, you could make a pretty decent argument that if you vaccinate later in gestation that you're going to make good immunity, good colostral immunity, and put it into those baby calves. But I think there's also an argument that some of those diseases that we're vaccinating against that cause abortion, we need that protection early on in the gestation. So probably a good rule of thumb is when you're thinking about breeding and turning the bull in, it's probably also a pretty good idea to be thinking about vaccinating your cows.
Very good. So Dr. Cox, I want to thank you for being with us on this episode. And also, I forgot to mention at the beginning that Dr. Cox is the Chief Operating Officer for Alliance Animal Care, as well as being a practicing veterinarian. And so we're happy that he's with us. And thank you so much for joining us on this episode.